with the prevention piece and how important it is that we have harm reduction practices and safe injection practices and safe consumption and wraparound supports for people so that we don't reinfect, because that can be a real big argument about why they don't want to spend money on people who use drugs, right? So JV is 36 years old. She was a former sex worker. She was street engaged since youth. She had a daughter apprehended when she was 15 years old. So she had a daughter when she was 15. She had gone through a lot of trauma, and she had been engaged with supports for a long, long time. She's injection drug user, conflict with the law, provincial and federal institution history. She sought recovery about 8 years ago, and at that time she treated with the standard PEG interferon treatment regime. It was a really rough treatment for her. I remember we were talking about it. She was 1 year undetectable cure. She had a partner. She met a gentleman in recovery. Her partner died, and she ended up going back out and turning to the way she coped and what helped her get through that. And it was a pretty hard go over 2 years, and she was back downtown, multiple injections daily, but she stayed engaged with the Women's Only Harm Reduction Drop-In Center, which was really important. She came in every day, she was in there, she got her supplies, she came back out. There was a lot of violence between a new partner she met on the street. However, and this is what I always talk about as well, there seemed to be an element of control for her own injections and refused to be seconded off the needle. She was able to come to a place that for her, she was able to get her own supplies that she needed. She didn't have to rely on anybody else. She was in contact with, support and peers and a safe place to go by accessing the drop-in. She wound up getting back into recovery, and she went back. I went with her. I remember she was so scared. She's like, it was such a blur, 2 years, and really worried she had reinfected herself, and she's negative. And we've done a follow-up after another 6 months. She's negative. So 3 years, and she now has a baby boy and a new partner, and now volunteers working with women. That is an example of what good support looks like, and that it doesn't mean we're going to reinfect. That we can be responsible for our own health if we have access to equitable health care, which means having the harm reduction supplies available, and that no matter where we are, we can access it.